I would like to talk to you about malaria and the effects it has in sub-Saharan Africa.
What is malaria?
So malaria, it is actually caused by parasites. These parasites, they live in our red blood cells. They are transmitted to people through infected mosquitoes. It's an acute febrile illness, and it can appear 10 to 15 days after you have been bitten.
What are the symptoms of malaria?
So the symptoms, it can be as common as the flu symptoms. You can have fever, headache, chills, vomit, diarrhea, but the more severe symptoms is respiratory distress, child's become anemia, and then it could also lead to death as well.
And who is at risk of getting it?
So in sub-Saharan Africa, because this is where my study was and what my project is all about, pretty much everyone there is at risk, but the majority of people at risk are in these 4 categories: kids under the age of 5 years old, as well as pregnant women, people with HIV and AIDS too, and then travelers, and then people who lack the immunity to it.
What makes it so significant?
So why this is so significant and needs to be more aware is because right now in sub-Saharan Africa, this is the leading cause of death. And despite medical advancements of this disease, it is still a major problem. This disease, it kills over 1 million people a year. It disables them. And this disease is high risk worldwide. But over here we have shots to help, medications to help. Over there in sub-Saharan Africa, 90% of their deaths are from malaria. And one very sad fact is that every 60 seconds a child dies because of this horrific disease.
How can this challenge be addressed?
Okay, so there are a few ways this challenge can be addressed. And they are doing stuff there now. And what they are doing is they do have people over there trying to help prevent the spread. They've tried to do insect sprays, but they're not allowed to do that anymore. But what needs to be addressed is that one major thing that we went over in class and that we watched a video on is that when this mom had 2 kids that were had mosquito bites or they had malaria, just getting to the doctors, that was their major problem. And that's a resource that we're able to have and that we have by getting into the car or just going and calling 911 and getting an ambulance. Over there, they did not have that resource. So unfortunately, one of the kids passed away on the walk there because she didn't have enough time. It was a 2-hour walk. So getting to the doctors is just a major challenge that they have. That's easy for us, but that's very hard for them. Another one is that over 30% of their drugs there that they can go and get are counterfeit drugs. So they don't even know that if the drugs that they are receiving are even working for them or their kids. And that's unbearable to think of. And then another one that's a major challenge and that I need to be aware is a resistance to anti-malaria drugs over there. A lot of them are becoming resistant to it. So those drugs are not working because their body is just used to it because of how bad the mosquitoes are becoming over there. Another challenge that need to be addressed is the vaccines. They need to be more effective. They're not effective because everyone is getting more resistant to the medicine, or the mosquitoes are getting more resistant. And also another challenge that's very big over there is where they live, the climate. So, because they're agriculture all the time, the families, that's how they survive and get their food and make the money. And so they're working in an environment that is unsafe and detrimental to their health.
So what's being done about all this?
And what needs to be done.
Mm-hmm.
So what needs to be done is we need to have bed nets over there. The reason why they don't like to have bed nets is because it is seen as poor people, but that is one of the things that will help 80% of the spread of it or have them getting infected is by having bed nets to stop them getting bitten. That is one thing that needs to happen more. They're not expensive. They're $8. So they need to have that protective over themselves. And Another one as well that needs to be addressed is their protective gear. They need to be in, like, they should be wearing thick socks, long sleeves, so when they're out there doing that work, they need to have more protective gear. We need to bring more protective gear over there, or people who come over there need to make that more addressed, that they should be wearing certain uniforms, or not uniforms, but clothing. It's just hard for them to pack up and move their housing, because that's easy for us to do over here, but for them that's like not easy at all. It's pretty much impossible. So they need better housing, but they can't get that because of where everything's at and where they live, and it's close to the water, and they need all that just to survive in their resources.
So what is the theme, and where does your class theme play a role in your topic?
So going over the list, I picked out like 4 of them that stood out the most to me and that were really relevant to my topic, and that we've been over a lot in class. And one of them is poverty. That was like the main one that stuck with me, is because over there they're all in poverty, and so that theme we learned a lot in class and talked about. And over there they work just to make money, to use that money to get medication for their kids, and that could probably be counterfeit or not even working. They don't even know. And so one thing over there is the poverty that they're in, because if their family, their dad is sick and can't work, then they have nothing to like use for themselves, the medicine. Another one that was really big as well to me that stood out is environmental factors. Kind of goes with poverty. These all kind of go together, because their environmental factors that they live in is horrific. Like their water, we don't even know that the water that they stand in, it could be dangerous. The grass can be dangerous, so they're getting infected by just working in those environmental factors as well. And then that also causes poverty if they're not able to work. Another one is their finance. These all just go together. The money that they make is not a lot there, and that money that they do make goes to protecting their kids from death. And then the last one I would say is their detriments of health. The health there is really bad because of malaria. 90% of deaths there because of malaria. A kid every 60 seconds dies. The doctors there will see 2 to 3 kids die a day in their hands because of it. So the detriments of health is bad. We went over a lot about immunity and vaccines over there, and it's not up to date what we have. And so that's one major problem. I think that's one of the most important, is the health over there, as well as like the environment and what they live in. And we need to bring more awareness over there so that other people know what's going on. So this was more brought awareness nationwide. We'd be able to see this, and I hope people would have like a personal effect with seeing what the kids have to go through to make a difference, and maybe try to bring medicine that's not counterfeit over there, or maybe go over there and try to give the kids better vaccines and educate everyone on that. I really enjoyed learning about malaria, and it just really opened my eyes to what we have compared to what's lacking over there, and made me want to like make just the smallest difference. Thank you.